in your question there. When you're sending your question, please give us your name and the media agency you're representing. François, please, French.
Bonjour et merci de vous être connecté pour ce briefing presse. Vous pouvez sélectionner la langue dans laquelle vous voulez entendre la conférence en utilisant l'outil d'interprétation de Zoom qui est disponible dans la barre d'outils qui ressemble à un globe. Vous pouvez sélectionner si vous voulez entendre en français. Et merci d'utiliser l'outil de questions et réponses Q&A de Zoom pour poser vos questions. Et merci de préciser votre nom et le média pour lequel vous travaillez avant de poser votre question.
Thank you. So joining us today for this interesting discussion is Dr. Mashidisho Moeti, the Regional Director for WHO Regional Office for Africa here in Brazzaville. We have from Niamey, Niger, Honorable Ibrahima Gimba Saidu, Minister, Special Advisor to the President of the Republic of Niger and CEO for the National Agency for the Information Society. Then from Nigeria in Lagos, we have Dr. Ola Brown, founder of Flying Doctors Investment Company. Then from Zimbabwe in Harare, we have Dr. Integrity Chisheshi, Junior Resident Medical Officer and Head of Innovation, Vaccine Global. You're all welcome once again. Let's now turn to Dr. Moeti, who will tell us how COVID-19 is spurring innovation in Africa. Dr. Moeti, please.
Thank you very much, Mary. Good morning, good afternoon, bonjour. And thank you for joining us for this press conference on how COVID-19 is stimulating innovation in Africa, with more than 120 health innovations piloted or adopted on the continent just this year. I'm very pleased indeed to be joined for this conversation by the Honorable Minister and Special Advisor to the President of Niger, Ibrahima Gwimba Saidu. Bonjour, Monsieur le Ministre, et bienvenue. As well as Dr. Ola Brown, the founder of Flying Doctor Investment Company in Nigeria. Ola, it's great to see you again, even remotely. And Dr. Integrity Mcheshesi, who is a junior resident medical doctor, as Mary said, at the Pariranyatwa Central Hospital in Zimbabwe. Welcome to all of you, and thank you, as always, to our APO group friends for the support with this press conference. COVID-19 is one of the most serious health challenges in a generation, but it's also an opportunity to drive forward innovation, ingenuity, and entrepreneurship in life-saving health technologies. In a new WHO study in August, we analyzed 1,000 health technologies developed worldwide in response to COVID-19 and found that Africa accounts for almost 13% of the innovations designed to enhance key areas like surveillance, contact tracing, community engagement, treatment, laboratory systems, and infection prevention and control. And I think we constitute probably 14% of the world's population. Almost 58% of the innovations were driven by information technology, ranging from self-diagnosis tools in Angola to contact tracing applications or apps in Ghana. And almost half of Africa's innovations were concentrated, though, in 4 countries, in South Africa, Kenya, Nigeria, and Rwanda. These homegrown innovations to fight COVID-19 are uniquely adapted to the African context. The pandemic has put a fresh impetus on the need to invest in innovation and to put in place the strategic frameworks to support it. And here we'll be very happy to hear from the minister from Niger. We know that investing in innovation yields tremendous dividends and that untapped talent and energy abounds in African countries. WHO has been working with countries to promote an innovation-friendly environment in the past 3 years. In August, our regional committee for Africa, meaning the Minister of Health's annual meeting, endorsed a strategy to scale up health innovations in Africa recommending greater investment in high quality health systems powered by continuous innovation to respond to changing population health needs. The inaugural WHO Innovation Challenge in 2018 unearthed 2,400 entries from entrepreneurs and innovators across the continent. Building on this, WHO's COVID-19 hackathon in March brought together 100 of the top innovators to propose solutions to emerging challenges in the response. This event led to several innovations being scaled up as part of national response efforts, including M-Safari, an app that builds on Kenya's M-Pesa payment system to facilitate contact tracing of passengers on public transport. Globally at WHO, we've set up COVID-19 Technology Access Pool. We've set up the COVID-19 Technology Access Pool to share intellectual property and data. And in the African region, we've created a global database of innovations to share knowledge, ideas, and successes. As far as the situation is concerned, there are now more than 1.7 million cumulative cases of COVID-19 on the African continent, and 41,000 people have died. We've seen a slowing down of the spread of the virus and a plateauing of cases in the past few weeks. As cases continue to plateau, integrating innovative approaches in the response will become increasingly important. Finally, with elections coming up in at least 8 African countries before the end of the year, and we have seen some of the reaction of the population in Guinea after the election results were announced, there are concerns about the risk of the uptick in cases as people come together during campaigns and voting. To prevent this, the public health capacities need to be up to speed, and people need to do their part to protect themselves and those around them by keeping a physical distance, wearing a mask, and practicing frequent hand hygiene. This is what we all have to do in our various communities as well. I look forward to our conversation today, and thank you once again for having joined us.
Thank you, Dr. Moeti, for the elaborate presentation on the situation of COVID-19 and all innovations in Africa. Honorable Minister Ibrahima Saidu, can you please tell us how Niger is promoting more innovation?
Sorry, the Honorable Minister seems to be disconnected right now. I'm not sure why.
Let's go to Dr. Ola Brown.
Dr. Ola Brown, could you tell us about what it takes to be an innovator and your COVID-19 innovations?
Thank you for that question. I'm very, very excited about the support that the WHO, the leadership of the WHO in Africa is giving to innovation, especially since Africa and innovation aren't typically associated with each other. But I'm glad that the studies and the statistics, including that really powerful 13% of all COVID-19 innovations or healthcare innovations around the world were found in Africa, is something that people wouldn't typically feel. Even hearing it, I was surprised that, globally, Africa can still account for so much of the innovation around the world. But that's not atypical when you look into history. And many of the greatest innovations that the world has ever seen have come from people and places that were marginalized and underestimated and underfunded. So when you look at the history of powered flight, for example, and airplanes, the German government had pumped a lot of money into the development of airplanes. The French government had pumped a lot of money into the development of powered flight as well, and so had the American government. But actually the people that succeeded were two kind of eccentric community-funded Wright brothers that nobody would have expected. And I think that this is why I'm so excited about African innovation, because history tells us that innovation comes from places that you wouldn't typically expect. And in terms of our own innovation for COVID, we've done a lot since the beginning of the outbreak. We've really had to think around, as a healthcare investment company, investing sort of end to end in the healthcare value chain. We really had to think quite holistically around the different problems that were faced in our unique environment and how to solve them. And the first innovation that we came up with was a testing booth that separated the tester from the patient. Because what we found is the typical way of going to people's houses and testing was using a lot of PPE. And we didn't have many people at that point that were qualified to take samples. So we're also getting high infection rates. So the first thing that we launched in one of the states was a testing booth that separated the patient getting tested from the tester. And we've rolled that out now in 8 states. And each one of those testing booths does about, or has the capacity to do about 200 tests per day. And we've not seen any infections when those tests have been, testing booths have been used. So that was the first innovation. The second innovation wasn't particularly technological. I think it was around process. And sometimes we forget how powerful process innovations can be. Supply chain innovations, being able to think, being able to do field work very quickly. So as two of our as a private sector person, a member of the Young Presidents Organization in the private sector, we were able to develop and put together and build within 3 weeks one of the most advanced intensive care isolation centers in the country. Over 200 patients moved through that center in the period of time when it was open, and that was also able to save a lot of lives. So 2 things that I think are important for innovation on the continent are, number 1, relationships, because none of these innovations would have been possible without relationships. And most of us are doctors on the call. I think this goes for doctors, it goes for physiotherapists, it goes for lab scientists. The route that we study tells us to be isolated from other people. It tells us to be specialized in one particular area. And it tells us never to talk to bankers because those people are very private, they're capitalists. But actually what we have to do in innovation is we need capital and we need relationships. So exactly the way we were trained, we need to do almost the opposite of it, because I think that, relationships are very important for innovations, and we were able to scale our innovations because of our relationships with bankers, who in medical school I always thought were very evil, because of our relationship with funders and because of our relationships with government. And I think also being able to control our narrative as well. In terms of the narrative around Africa, our news is always told for us. And what does the news say? It says that we're in need of aid. It says that, we're needy, that we can't really do things for ourselves. So being able to tell our own story in a way that sort of attracts capital, attracts FDI, because right now, even though Africa makes up a significant proportion of the population, in terms of global investment, actually, it's very small. I think it's less than 5% of global investment comes to Africa. So in order to attract that investment, we also have to work on the way that we tell our narrative and the way that we tell our stories. And again, as doctors, I don't know if the Honorable Minister will agree with me, but doctors tend to be very humble. We don't talk about what we do. We have to, we don't promote it and don't, talk too much about it. And I think that, as a medical community, I think we need to get more comfortable with telling those stories and being able to tell them in a way that attracts investment onto the continent. Thank you.
Thank you, Dr. Interesting innovations out there. Honorable Minister, welcome back. Can you please tell us about how Niger is promoting more innovations? Honorable Minister Rahima Saidi, please unmute yourself.
Okay. Can you hear me?
Yes, go ahead. Thank you.
Okay. Thank you very much. And sorry for the glitch that has happened since the beginning of this event. I guess that's also what technology is about. I'll switch to French if you allow me, given that we're Francophone country and I believe we have interpretation. Madame la représentante, la directrice régionale de l'OMS, je suis honoré d'avoir été invité à cette conférence de presse, à plus d'un titre. Tout d'abord, je suis fils de médecin, donc pouvoir t'associer en ce moment à un événement autour de la santé, autour de la médecine, c'est absolument un grand honneur pour moi. Au niveau du Niger, effectivement, la technologie, si vous voulez, a joué un grand rôle. Depuis quelques années, le gouvernement a décidé d'en faire son fer de lance au niveau du développement socio-économique, du plan de développement socio-économique qui est en train d'être mis en place. C'est dans ce cadre qu'autour du ministre de la Santé, déjà une stratégie de e-santé a été mise en place en collaboration avec l'ANSSI et d'autres acteurs de l'écosystème. Depuis quelques années déjà, nous avons commencé à nous organiser pour introduire graduellement la technologie et l'innovation dans le secteur de la santé, notamment à travers la télémédecine, notamment en mettant en place des plateformes de collaboration entre les différents acteurs de la santé, notamment en ayant des activités aussi qui faisaient la promotion de la santé. Nous nous sommes dit qu'au vu des challenges auxquels le pays faisait face, parce que nous sommes un des pays où certains aspects de la santé tels que la mortalité infantile maternelle sont très élevés et nous sommes un pays où une bonne partie de la population ne se trouve pas en milieu urbain, qu'il était absolument important de voir comment est-ce que la technologie pourrait nous permettre de porter assistance à cette importante frange de notre population. Donc, nous nous sommes organisés autour du ministère de la Santé avec l'ANSSI en embarquant surtout dès le départ l'écosystème. Donc, tout ce que nous avons comme jeunes travaillant autour de l'écosystème a été organisé. Nous avons établi des compétitions régulières, notamment une compétition qui est la première dans la sous-région, qu'on appelle Itakara, que nous organisons depuis 3 ans, qui consiste en fait à détecter de l'innovation et du talent partout sur le continent, sur l'étendue du territoire. C'est une compétition annuelle qui dure plusieurs mois. Elle est faite au niveau régional. La question est simple. Nous demandons aux jeunes et aux spécialistes des secteurs de nous donner des indications sur des solutions qui pourraient, une fois développées, permettre de changer de façon importante leurs conditions de travail ou bien les conditions de vie des populations. Donc, cela est fait pendant plusieurs mois. Nous faisons des régionales et les 3 meilleurs de toutes les régions sont regroupés en fin d'année dans une ville, ainsi que les 3 meilleurs de la diaspora. Parce que le Niger, c'est non seulement les Nigériens qui sont au Niger, mais aussi c'est les Nigériens de la diaspora. Donc, nous les regroupons pour maintenant avoir la finale nationale. Et les vainqueurs de cette compétition sont accompagnés pendant au moins 1 année à travers une incubation pour qu'au bout de l'année, il y ait au moins un prototype qui soit viable. Il y a en 2018, lors de la 2e édition, par exemple, le vainqueur de la compétition a développé une application qui permet de détecter le palu ou la malaria sans prise de sang, avec de l'intelligence artificielle et ce qu'on appelle du machine learning. Donc, depuis, nous sommes en train de travailler avec lui et le ministère de la Santé, avec aussi vraiment l'appui du bureau local de l'OMS ici, pour essayer de parfaire cette solution. Bien entendu, comme dans beaucoup de pays, la COVID, en fait, a été un véritable, j'allais dire, wake-up call. Pendant qu'on essayait d'introduire l'innovation, la technologie dans le domaine de la santé comme dans d'autres, il y avait un certain scepticisme parce que beaucoup de gens se disaient qu'on n'était pas prêt, qu'on n'avait pas le potentiel et qu'il y avait d'autres priorités, qu'il fallait continuer de faire les choses de la même façon qu'on le faisait, même si ça coûtait beaucoup d'argent. La COVID nous a mis dos au mur. Il a fallu innover rapidement parce que nous avions déjà ce cadre dont j'ai parlé. Tout l'écosystème s'est regroupé autour de l'ANSSI pour développer, et vraiment je suis fier de le dire, en quelques semaines, toute une panoplie d'outils autour de la COVID pour apporter déjà assistance, j'allais dire, à la communauté. Des plateformes, par exemple, de renseignement dans toutes les langues nationales ont été déployées rapidement par des jeunes, un site web avec des outils d'autodiagnostic et puis même de la télémédecine, parce qu'il y a des médecins volontaires qui sont mis à notre disposition pour, en ligne, porter assistance à des patients éventuels ou tout simplement à des personnes qui se posaient des questions sur la COVID. Et bien entendu, peut-être un des événements majeurs a été l'organisation de ce que nous avons appelé un Coronacathon, qui était spécifiquement dédié au corona ou à la corona, pour laquelle une grande participation a vu le jour. Finalement, pour ne pas être très long et puis laisser un peu la place aux questions, nous nous sommes dit que tout cela doit se faire sur le long terme. C'est dans ce cadre que nous avons mis en place un centre d'excellence, une cité de l'innovation à 35-40 km de la capitale, à Sadoré, où déjà nous avons lancé une académie de codage et où nous sommes en train de mettre en place un pôle sur la santé, notamment un cluster autour de la santé, avec les acteurs de la santé, y compris la faculté de médecine, le ministère bien entendu, l'OMS et d'autres partenaires, pour ensemble voir les solutions les meilleures qu'on pourrait déployer sur toute l'étendue du territoire. Donc oui, l'innovation, j'allais dire, et la santé sont intimement liées maintenant. Et pour des pays comme les nôtres, c'est un outil absolument incroyable pour amener la santé sur eux à tous, partout où ils sont, et de la façon la plus efficiente possible. Je vous remercie pour l'opportunité et je me tiens prêt pour les questions qui pourraient venir. Merci.
Merci beaucoup, Honorable Minister. Indeed, COVID-19 is a wake-up call for more innovations in Africa. Dr. Integrity, can you please tell us about your innovation?
Thank you so much. Good afternoon and good morning. So I am the head of innovation at Vaxi Global. As we've seen countries opening up, most African countries, they require the COVID-free certificates before the point of departure. But as we've probably seen in the media of late, there's a thriving black market of these fake COVID-19 certificates. And it's obviously putting everyone at risk, risking, pushing the transmission across borders. And it's difficult for the health authorities to verify the authenticity of each and every certificate using the traditional signature and stamp. So that's where Vaxi Global is coming in to solve this problem using a decentralized online record keeping system that is built on blockchain technology. So we had built this system with support of the WHO Africa Innovation Department to combat counterfeit yellow fever certificates. And now with COVID-19, we've adjusted the system also to cater for the COVID-19 certificates, where laboratories enter the COVID results of the travelers and the QR code is generated that is either printed on the certificate or sent to the traveler's phone. And so when they get to the Port Health officials, they simply scan the QR code to see the authenticity of each and every certificate. So the Ministry of Health in Zimbabwe acknowledged, the magnitude of these fake certificates problem. And we have partnered and we've been rolling out the system at Harare Mugabe International Airport. And even as we wait, for implementation of other broader transcontinental solutions on this problem of counterfeit certificates, at least we are glad that at a country, local level, we are being responsible enough to minimize or even make sure that we don't export cases out of Zimbabwe. So we encourage even other governments as well to collaborate with local innovators, like ours, to implement, these solutions, like what Dr. Ola Brown has been saying, that it's only these relationships between the government and the innovators and even the public health workers that is going to help, make our innovations really be impactful. Thank you.
Thank you, Dr. Integrity. So we are now going live. The first person to ask question is Naftali from Shinua. Please ask your question.
Hello. Hello, can you hear me, Dr. Moeti?
Go ahead, we can hear you.
Yes.
Go ahead.
Yes, I just want to know from Dr. Moeti, in terms of innovations, which African countries are doing better in terms of health innovations? And secondly, do you see these innovations helping us defeat COVID-19 once and for all?
Yes, thank you. Thank you for that question. And as I indicated in my introductory remarks, that the countries that have the most, in terms of number, innovations are South Africa, Kenya, Nigeria, and Rwanda. And there are other countries where people at different levels, some in South Africa, some in Uganda, for example, Angola as well. And we were just hearing from Ola about, of course, she's from Nigeria, innovations in Nigeria. It tends to be the bigger countries, those with more developed scientific systems. I think if we look as well at which are the countries that are doing the most research in the region, South Africa, Kenya, Nigeria are among those. But you know, I think Ola put it very well. Sometimes you can get innovations coming out of places that are not the most obvious. So for us, it's very thrilling that somewhere like Angola, there have been some innovations that have emerged from there. So I think what we want to say, and we heard the minister from Niger as well tell the fact that if a government has taken the decision as part of their policy to support in the way that he was talking about, innovation, encourage young people, give them some motivation, some support and accompaniment, we can get innovations from everywhere. I think it needs the will, it needs the political and policy decision-making, and it needs the strategic approaches and making the links between the innovators, those who might finance, and also those who will provide the policy environment, the governments. Certainly, these innovations are contributing in the individual countries to the response to the pandemic. What we would like to see is growth in this work, spreading some of the innovations from one country to the next so that they get adopted, so that this knowledge, this ingenuity gets applied to address the pandemic all over Africa. I think, of course, some of the biggest innovations that are taking place in terms of what we are going to be needing for some of the public health interventions are around testing. The biggest innovation we're waiting for now is the vaccine. I think it's going to be a combination of all this that helps us to bring an end to this pandemic.
Thank you, Dr. Moeti. So now we are going to Mensin from ZDF, Germany, to ask the next question. Over to you, Mensin.
Hello, thanks for the opportunity. We're German TV based in Nairobi, and we have two questions. First, what is your impression of and explanation for the recent increase of 45% in cases in Kenya? And second, what is the status of the quick testing kits, and when will they be available and for who? Thanks.
Okay. Dr. Moeti, you go first, and then we can ask the minister to complement.
Do something about that.
Dr. Moeti?
I'm sorry, Mary, my apologies. I was not able to hear the questions. Could she possibly say that again?
Can you say your question again, Mensin?
Yes, sure. Our first question is, what is your impression of and explanation for the recent increase of 45% in cases in Kenya? And secondly, what is the status of the quick testing kits, and when will they be available and for who?
Okay. Yes, thanks very much. So indeed, Kenya is experiencing an increase in new cases over the past 4 weeks or so. You know, we've said all along, we have seen overall in the region a downward trend, which has slowed down in the past couple of weeks, and we've seen a plateauing, a flattening of this curve. And then at the same time, and I think Kenya is an example of that, as the country has progressively opened up for people to move around, schools to open, some gatherings to happen. We have seen in some of the countries an increase in cases. In Kenya, the schools have opened up, for example. We also understand that there have been some public gatherings of a political nature that have taken place. So for us, an uptick linked to the loosening and easing of the movement of people means that there is need to double down and make sure that at the local level, based on data on where these increases are happening, because they will not be happening all over the place. And in Kenya, we understand that it is primarily in Nairobi and in Mombasa that we have the main hotspots. And we see those are big cities, sometimes very overcrowded conditions. And it's sometimes good even within the city to see where are the transmissions happening. And it is possible to do that now. In Kenya, I believe they've intensified the testing, and I'm certain this will be followed by a more intensified contact tracing. It's important for this contact tracing to be rapid so that you get the contacts and you isolate them and the cases before they spread the virus further to more people. So we think it's linked to the easing of some of the measures, and it's not unexpected. So we expect that in more and more, and in some countries, as the measures are eased, and this is absolutely essential for the economic recovery of the countries to start to happen, we will need to be dealing with some of these upticks. What's most important is to contain them without the situation getting completely out of control. And then as far as the rapid diagnostic tests are concerned, we were very pleased and encouraged to be able to share the information about the emergency use license that WHO has given to a couple of rapid tests that's going to really change the situation. As we said, globally, 120 million of these are being made available to low and middle income countries. And we have seen that some countries have already started being provided with these. So some have been shipped to countries like Burkina Faso, Cameroon, DRC, Ethiopia, Ghana, Kenya, Malawi. So all of our low and middle income countries, which is virtually the whole of Africa, are going to get some of these tests made available. And what is important is the work that's being done now by a number of partners, including the Africa CDC and UNITAID, to distribute these tests with countries. I'm sure they will help some of our countries to increase the testing rates. This is very important to be able to keep on top of and even ahead of the situation so that we can contain the upticks that we are expecting and anticipating now that countries are forced to open up movement of people and their economies.
Thank you, Dr. Moeti. So if you're just joining us, we are on the weekly media briefing for WHO Afro. Today we are discussing technological innovations and COVID-19 in Africa. So please send your questions to the Q&A session, and you can use the icon for interpretation and select the most appropriate language for you. Next, we are going to Paul from DVEX. Please ask your question.
Thank you very much. I have two questions for Dr. Moeti. The first one is that what is being done to ensure that technological innovations in one part of Africa is standardized and quickly made available in other parts of the continent? While the second question is around July 2020, the WHO worked with the World Trade Organization to find ways to promote access to medical technologies and innovation. But today, an African woman's election to head the organization is being blocked by the US government, which also recently had issues with the WHO itself. So what is Dr. Moeti's view regarding Ngozi Okonjo-Iweala's present predicament? And what do you think her position as head of WTO will mean for Africa? Thank you very much.
Okay. I think, you know, the type of platforms that we as WHO are working with other partners to put in place to share the information about technologies that are being developed in one country with other member states are some of the ways in which we can see people becoming aware of what's happening and people becoming interested in obtaining those, in supporting these. I think there are many networks that can be established and many platforms that can be established so that people who are interested, who are developing innovations, people who are interested in financing and investing in innovations. And I think we need to emphasize as well, I'm sure Ola can come in here and give some ideas because she was talking a lot about being connected and she's been involved in some of this at the regional level as well. And then among the governments, the example of Niger, example of Rwanda, there are several other countries where the government has adopted this as part of their development and growth strategy. So if we can promote a like-mindedness among the leaders so that they, inspire each other, stimulate each other to take this on as part of their economic development. These kind of discussions can take place at the sub-regional level. I know that President Paul Kagame, who is a very strong proponent of innovation for development in Rwanda, is a kind of thought leader in the African Union. And we can find platforms, including among people in the private sector, the finance institutions, to really support innovation for health in Africa. I think this is very important.
Go ahead.
Ola.
We've been working for the past 2 years in mobilizing capital and investment across Africa. And we have a portfolio, in our portfolio, the companies are already worth $200 million. So we've been gradually scaling up those companies across the continent over time. So I'm a big believer in the role that institutions like the WHO have to play in setting the agenda for innovation. And I think that it's quite unique on the continent, the agenda for innovation, and maybe a bit more complex because of what I think his name is Professor Curran in his HBR article, Winning in Emerging Markets, calls institutional voids. So things like the fact that we have poorer road networks in Africa, the fact that we perhaps have problems with electricity in Africa, it makes that scale of innovation a bit more difficult. But he also presents in that same article that these institutional voids are actually opportunities. So I think that the WHO and other global institutions do have a role, but the biggest role comes down to, in terms of scaling, comes down to policy of at the government level. So making sure that structural policy, ease of doing business, airports, infrastructure works, because that makes scale easier and it makes the countries more attractive for investment, but also the role of private capital. And I spoke about that earlier with regards to getting investment companies or investment institutions that are active on the continent and are not only active in one region or one country, but actually have relationships across the continent, so that these investment capital vehicles aren't just providing the capital, but also providing the relationships along with the know-how to enable these companies to scale their innovations across borders. When I first spoke, I said that innovators, apart from the innovation and the idea, need two main things. First of all, capital is very, very important. But even with the capital, they also need the ability to be able to tell the narrative in a story that will attract the capital. And don't forget that some of the greatest innovators in history, people like Rockefeller, people like Carnegie, I don't know whether you remember the story of, nobody believed Carnegie when he said that steel was hard, because he was the original inventor for steel. So he had to bring an elephant to jump on the steel bridge, and even invited the press to come and see. And that's how Americans actually got convinced of his innovation. So he was not only a great innovator and a great mind, but a great marketer. Think about the imagery of bringing an elephant to come and walk over something to prove that it's strong enough to take an elephant, so it must be a good innovation for construction. So I think, that capital and building a strong narrative around the innovation to attract the capital, and the right kind of capital, connected capital, smart money, is a really, really important part of helping those innovations to scale.
Thank you, Dr. Ola. Minister, do you want to add to this?
Okay.
Yes, please. En fait, donc, je voudrais juste rajouter quelques éléments, surtout par rapport à la coopération sur l'innovation au niveau du continent. Je voudrais indiquer qu'à travers, il y a un cadre qu'on a mis en place, donc autour des ministres du numérique et de l'innovation au niveau africain, à travers l'organisation Smart Africa, qui est justement basée à Kigali au Rwanda. Et ce que nous faisons donc à travers cette organisation, c'est mettre nos ressources en commun pour que chaque pays puisse participer à cet effort commun du continent. Vous prenez par exemple un pays comme le Niger, notre contribution est un pays absolument rural, c'est de voir comment est-ce qu'on peut déployer la connectivité dans les zones les plus éloignées, parce que les villages, ça existe partout sur les continents, mais chaque pays ne doit pas forcément se focaliser là-dessus. Donc, c'est ce que nous faisons. Et là, même dans le cadre de la COVID, nous avons tenu plusieurs rencontres virtuelles autour du directeur de Smart Africa pour partager les différentes innovations dans les différents pays et puis voir comment est-ce qu'on pouvait justement partager cette expérience et puis utiliser les progrès que chacun des pays a pu réaliser. Donc, ce contexte existe et vraiment, il y a une coopération formidable autour de ça. D'ailleurs, Smart Africa, ce sont les chefs d'État qui sont à la tête. Le président Kagame comme le président Issou sont membres du conseil d'administration et nous sommes là donc pour travailler en commun. C'est ce que je voulais rajouter des deux intervenants. Merci.
Thank you, Honorable Minister. Dr. Moeti?
Thank you, Mary. There was a second question about the WTO election. You know, Dr. Ngozi is somebody with whom we have worked in her different roles. She's the chair of the board of Gavi, or she was until recently, and somebody who has very strongly promoted global health. In fact, she has joined us on one of our press conferences here. So she's somebody whom we feel is very well qualified for her position. Worked with her when she was in the World Bank and as well when she was the Minister of Finance in Nigeria. I'm certain that the WTO will find the means to have the outcome of this election respected. And Dr. Ngozi confirmed, I think what I can say is that we would be extremely proud to see the first woman be an African woman at the head of this very important international organization, which is so critical for international trade, where we know that there are many important changes that need to happen to put in place a fair international trade system for countries like Africa to benefit from. And I think my comment is only to say that we believe in her competence and capacity for this position, and we wish for an outcome and a resolution that will be based on the outcome of an election, which was an open process, we understood. Thanks.
Thank you, Dr. Moeti. Now we are going live to Duncan from Reuters. Please ask your question. Duncan, are you there? Okay, if he's not there, I will read out the question he posted to the chat. How do you assess the infections trend on the continent since governments lifted increasingly more lockdown measures a month ago? The second one is, which countries are you particularly concerned about? The third one is, what should governments do to contain an upsurge of infections? To you, this question is to you, Dr. Moeti.
Okay, thank you. Thanks very much for that question. That's our central preoccupation at the moment. You know, we had seen a fairly steady decrease in cases in Africa since about July. And then we started seeing some of the countries open up, as I was saying before, releasing the slowdown, releasing the lockdowns. In the last couple of weeks, we have seen a slowing down of this decrease. And in fact, we've seen a kind of flattening of the curve. It's no longer going down. It has plateaued. And we have seen that in a number of countries, this is linked to two things: more and more the opening up of the lockdowns, people starting to move around more, starting to gather more. And we also think, as is happening worldwide, people are getting a little bit exhausted with the measures, you know, at the personal level, with the consistent wearing of masks, with making the effort to keep a distance from your neighbor wherever you are, and with the hand washing and hygiene measures. So this is what we think is happening. And as I said, I am personally very concerned that, you know, this is happening as we are needing to open up more and more. Okay, there's a lot, and I'm sure you've seen in some of the media, even religious groups gathering and pushing to be able to gather. Maybe people are tired of not being able to practice their religion in the way they are used to in gatherings. We've had many people doing that remotely, virtually, or for more than half a year. So which are some of the countries that are increasing in terms of cases? We already had mention of Kenya. South Africa is another one where we had been seeing a steady decrease in cases. Now there are a couple of new hotspots in South Africa and a slightly concerning uptick of cases in Ethiopia as well, in Angola, in Algeria, in Mozambique, Uganda, Botswana, Cabo Verde, and also Nigeria. These are some of the countries where we are seeing the largest number of cases in the past week, for example. And we need to make more and more efforts, as I said, to simply ensure that the public health measures are working quickly and are working effectively, meaning testing. Testing is extremely important to know where the infection is. And that's why we think that these RDTs that we were talking about are going to be very important, where you see that there could be a cluster of cases or community spread, to be able to get in, quickly test, get the results quickly, identify the contacts, and most importantly, make sure that then we're isolating people. And then secondly, I do believe that working with the community needs to be intensified. You know, so people need to be re-inspired to sustain the effort of living in this not very normal way. We need to find perhaps better ways also of making sure that we protect the most vulnerable. So if we have elderly people in our families, what can we do, even if we have an increase in cases, to make sure that they don't get infected? Because our data shows very well that the rate of people dying among those who are older and those who have pre-existing conditions is higher. And finally, just to say, at the country level, as I said before, there may not be need to impose a countrywide lockdown. Data, the numbers need to tell us where to focus, how to focus these lockdowns, how to intensify the communication with people, how to listen to people, how to find ways to carry out surveys, conversations, so that we understand their limitations and their constraints. I think if we do that, if we're more interactive in our communication with people, you know, in addition to officials coming to speak to them over the TV or over the radio, we need to understand on the ground what's happening that is stopping people doing their part, and then to take the action to support the work that the effort that they have to make at the community level. And then finally, just one issue that I think is very important, you know, the economic impact of the pandemic in Africa was very quick because of the lockdowns, which were necessary, and very severe. And I believe that our countries need help, support to put in place some mitigation measures at the household level, so that people are not struggling with the basics of putting food on the table on a day-to-day basis. I think it's when people have those kinds of support that they can sustain their own individual and household efforts to limit the spread of the virus. Thank you.
Thank you, Dr. Moeti. The next question is to you, Honorable Minister Ibrahima, from Pamela, Channel Africa. How do vulnerable populations in Niger access information about COVID-19? Do they have access to alert system?
Oui, donc merci bien pour la question. Donc au niveau du Niger, nous avons mis en place un mécanisme qui permet aux populations d'avoir accès aux informations sur la COVID. Par exemple, nous avons mis en place un numéro court qui est un numéro gratuit, le 701, qui est accessible par tous les opérateurs gratuitement et qui permet aux populations de se renseigner. En plus de cela, nous utilisons à travers les différentes plateformes, par exemple WhatsApp, nous avons mis en place un groupe d'information WhatsApp avec donc la compagnie qui le fait, le ministère de la Santé, qui est accessible gratuitement aux populations, qui leur donne des informations sur l'évolution des cas, qui leur donne des informations aussi sur les conseils que le ministère de la Santé donc, envoie. Donc, nous avons ces outils à travers les numéros libres, à travers les groupes WhatsApp, à travers aussi le site web, et puis à travers tous ces de réseaux sociaux. Et finalement, et pas des moindres, la radio et la télévision est beaucoup utilisée pour disséminer l'information. Voilà. En plus des organes, et peut-être c'est le dernier point, nous avons des groupes sociaux, que ce soit des groupes religieux, que ce soit des groupes autour des chefs traditionnels, des communautés. Donc, en fait, ce que nous faisons ici, c'est tout simplement utiliser la technologie donc, pour rendre rapidement accessible à ces différents relais que nous avons dans les communautés les informations les plus pertinentes. Parce que pour faire face à la pandémie, c'est déjà la bonne information. Donc, éviter qu'il y ait ce qu'on appelle les fake news ou bien il y a beaucoup de fausses informations par rapport à la pandémie. Et deux, c'est aussi la prévention. Donc, tous ceux qui sont leaders, que ce soit des leaders d'opinion, des leaders de communauté, des leaders religieux, nous sommes en contact avec eux à travers les différentes plateformes pour qu'ils aient accès aux informations. Et mon dernier point, c'est que nous avons régulièrement un comité interministériel autour de son Excellence le Premier ministre, avec justement une partie de ces chefs communautaires pour que la bonne information leur soit transmise à temps et pour qu'ils puissent les disséminer rapidement dans les églises, dans les mosquées et dans les différents lieux de rassemblement. Merci.
Thank you, Honorable Minister. Dr. Ola, the next question is coming to you, and then Dr. Integrity can add to it. The question is, are all innovations meant for COVID-19, or can we use it later to help countries build stronger and more resilient health systems for them to be better prepared for future outbreak? To you, Dr. Ola, and then Dr. Integrity can add.
So I think that history is littered with examples of something being created for a particular purpose, and then us finding out that actually it has applications, way beyond that purpose. So even the internet was actually created, it wasn't initially created for general use, but it became, this great thing that we're all enjoying today and using to communicate. And in the same way, even things like a Google innovation, Google Glass, was a pair of glasses that people thought would be used for social purposes. But actually now it's being embraced by remote working to help people, supervisors, see what perhaps less experienced members of staff are seeing. So totally, I think that a lot of things that we have been working on at our investment group and our innovators and the companies that we've invested in have been working on have applications outside their original use. So our testing booths, for example, were originally designed for COVID-19 testing only. And they have a pair of external gloves where people can reach outside to do the test so that they don't have to come in contact with the patient. But actually, we've already had a few requests from government saying, after the COVID-19 epidemic, can these be repurposed to telemedicine booths where I mean, in Nigeria, and I'm sure also in Niger, there are remote places where doctors don't want to live. It's very hard to even post the most junior doctors there because it's too far away from the cities, and that means that they don't have access to healthcare. So can these be refitted with solar panels and then be repurposed into telemedicine booths where people in very remote areas, riverine areas, can consult with doctors using technology. So I do think that a lot of this innovation, followed by the right narrative, the right relationships, the right capital, and the right government support, can live way beyond COVID. And the potential for some of these, especially technology applications and even process innovations that have kind of skyrocketed in the area of health across Africa, have applications in Africa beyond COVID and hopefully globally as well.
Thank you, Doctor. Dr. Integrity, do you want to add?
All right, definitely I agree with Dr. Ola Brown. What I think has happened is basically innovation in the health sector is slower compared to other sectors. What COVID-19 has done is sort of like compressed innovations that have been taking sort of like 5 years to get developed, and it has compressed them to be developed within 1 year. So what we've seen is COVID-19 giving us a platform, for example, of adopting telemedicine, like what Dr. Ola Brown was saying. So yes, we are using telemedicine now in the when we are during the COVID times, because people want to go to clinics they're afraid of going to clinics so that they think they can contract the disease. We realize that as COVID is going to be, as we're getting into the post-COVID era, telemedicine that has been traditionally, slowly accepted, is now here to stay. So COVID-19 has done a good thing in helping us adopt these technologies, which were being traditionally slowly accepted. Our innovation of verifying health records, we are verifying COVID-19 certificates. Post-COVID-19, we still have other immunization cards that still need to be verifiable. So I feel like these innovations, which are strengthening the health systems, they are here to stay. And COVID-19 is actually given us a platform for accelerating innovations in the healthcare space.
Thank you, Dr. Integrity. The next question is to you, Dr. Moeti. This is from Mutanu. Why are there increasing deaths yet community transmission has been there for a while? Shouldn't the population have built herd immunity by now?
Okay. Thank you. There's been a lot of discussion, some of it very hot and controversial, about herd immunity, including what sort of strategies and whether it's justified by the cost in terms of deaths. I think we're trying to continue to learn more and more about this virus as far as immunity is concerned, if it confers. So we know, for example, that there have been some cases of reinfection, very few compared to the total number of cases worldwide. It's not certain what is the duration of the immunity even. So I think I can say that this is one thing that we're still continuing to learn about. The deaths, of course, we know that many people can be infected, especially people in the younger age groups, without getting seriously ill, without getting complications and dying. And we have seen that the case fatality rate, for example, among people over the age of 60 is much higher, and even higher among those who are in their 70s going into the 80s than people between their 20s, the ages of 20 and 40, which is where we have the highest proportion of cases. I think deaths, we need to look at several things. One, are they really COVID deaths, or are they COVID related due to the fact that we are having difficulties, as was being said by Dr. Mchechesi, with people accessing health services for other conditions, which are increasing the number of deaths. And then we also need to understand that COVID-19 is a new illness whose clinical picture, manifestations, we are learning about all the time. And what is very important is to make sure that what is put in place in our countries in terms of treatment is keeping up to the emerging knowledge about it, so that the type of medicines that you have to have in place to use are dealing with the different ways in which this virus can affect a person, including blockage of the blood vessels in some key organs of the body, which can cause multiple organ failure. And the fact that we still don't have enough capacity as far as intensive care is concerned. We need to be adjusting and continue to increase the supplies of oxygen in our countries, hopefully before people become ill enough to actually need to be put into a ventilator, because once somebody gets there, then the death rates among those severely ill patients is very high, up to 50%. So I think we need to understand all of this, but the most important thing is to continue to learn about the virus, adapt in terms of managing the cases, try to be aware of some of these complications early, train the doctors and the nurses who are looking after patients, so that we continue to modify the day-to-day management in our health facilities. And even if people get ill because they're infected, to minimize the numbers that are dying.
Thank you, Dr. Moeti. We are coming to the end of this press briefing. So I'm coming back to all panelists for your final remarks. You have 1 minute each, starting with the Honorable Minister, Dr. Ola, Dr. Integrity, and then Dr. Moeti will wrap up.
Merci bien. Donc pour moi, juste quelques mots. L'innovation, c'est pas l'invention. L'innovation, c'est l'adaptation vraiment des technologies pour résoudre un problème. La COVID-19, comme je le disais, a été un wake-up call pour le continent. Pour un pays comme le Niger, qui a environ un médecin pour 17-18 000 habitants, vous voyez bien l'intérêt pour nous. Tout d'un coup, ce focus sur l'utilisation de la technologie pour faire face à nos défis de santé devenu prioritaire nous permet d'avancer sur l'amélioration de ce cadre. La deuxième chose, comme l'a dit Dr. Ola Brown, c'est qu'effectivement, il n'y a pas de médecins dans les zones rurales. Au Niger, on est extrêmement rural et nous innovons à travers justement le recyclage d'autres outils qui sont là. Vous prenez juste le téléphone cellulaire. C'est devenu aujourd'hui un outil de médecine, c'est un outil de télémédecine. On peut faire des consultations à travers ce simple appareil. On peut aussi avoir récupérer certains éléments pour les médecins à travers médium. Donc, on réinvente un peu la médecine pour nous. Et l'innovation, donc, est notre allié peut-être le plus important. Et l'innovation, surtout, pour un pays comme le nôtre aussi, comme l'a dit Dr. Moeti, permet d'avoir des données. Ce sont les données qui vont aider à prendre les bonnes décisions. Ce sont les données qui vont permettre à nos autorités de focaliser le peu de ressources qu'il y a dans les endroits où on pourrait avoir le plus gros impact. Merci encore une fois de m'avoir fait l'honneur de m'inviter à cette session. Merci.
Thank you, Honorable Minister. Dr. Ola, please.
So I'm going to finish up with sort of a summary of what I've said before. Scaling, so my perspective comes from, of course, originally training as a medical doctor, and then training as an economist and having qualifications in finance, and now, of course, building up a healthcare investment company. So I think the first point that I spoke about is innovation can be found in the strangest of places. And some of the companies that we've invested in that have performed exceptionally have been companies that you wouldn't necessarily expect at first glance. And I think it's important for us as Africans to bear it in mind that we have the capacity to do this. And it's also important for innovators to bear that in mind as well, especially with the funding constraints that sort of typify the African entrepreneurial system, where access to credit, access to funding isn't as isn't as available as you would see in other countries, say in the West or in Asia. The second point I'd like to make is around our narrative. And how we promote our innovations. Like I said before, doctors tend to be very humble and very understated, and so do people in technical professions. So engineers, for example, lawyers, and people where you would tech programmers don't really speak about innovation so much and aren't so good at controlling their narrative. And that's something as innovators and entrepreneurs, I think that we need to get comfortable with. And definitely, I had to work quite hard to get comfortable with talking about innovation. I can't sort of wrap up the conversation without going to my second discipline. I've spoken about the medical side, but I'll also speak about the economics as well. The fact that, as the Honourable Minister will well be familiar with, a lot of the macroeconomic situations that we have in Africa aren't really conducive for investment and kind of maybe sometimes scare international investors off. So our economies are typically, very, very highly leveraged in terms of debt, low revenue, and then structural issues as well, such as high inflation rate, difficult to do business, low infrastructure, electricity, etc. And these are, the kind of things that international investors look at and think, oh, do I want to put my money here or do I want to put it in a safer place? And I always say that capital innovation is like a beauty contest. Investors are always looking for the most beautiful, kind of safe, comfortable candidate to take their capital to. And I think that a country that was mentioned earlier, Rwanda, has done an excellent job of being that beautiful candidate where international investors feel that they can take their capital to. And I think that there's a lot of African countries that can learn a lot from that. So in summary, narrative control, building relationships with international investors, and sorting out our macroeconomics as well, and building relationships not just with investors, but also government reforms, especially structural macroeconomic reforms, will really be the keys to helping us scale our innovations across Africa and beyond. Thank you.
Thank you, Doctor. Dr. Integrity, your final words, please.
All right, I'd like to finish by saying, we have seen this exponential growth in innovations, relevant applications, digital interfaces, and virtual diagnostic tools addressing COVID-19 and other conditions as well. But all too many of these efforts are just siloed within standalone organizations and research centers. So like what Dr. Ola Brown was saying, we need to collaborate going forwards, so that we don't have the solutions only stuck within, large organizations only. And I think we also need to focus on, equity and accessibility, so that all these response strategies that we're putting in place, they don't exacerbate, the existing biases and disenfranchisement in the healthcare systems. For example, in Zimbabwe, there was a time when we wanted to use like AI and metadata to try and see the hotspots, the next hotspot of COVID-19. But using metadata, you're only getting data from people who have mobile phones. But we know some of our people do not even have mobile phones. Therefore, if we're going to make policies and changes using that data that is not adequate, it was obviously going to leave out those guys who have no access to mobile phones. So I think going forward, it's very important for us now to make sure that our solutions and our innovations are all inclusive and we focus on equity and accessibility. Thank you so much.
Thank you, Dr. Integrity. Dr. Moeti, before you go to your final remarks, we have some few questions on the protest in Nigeria. If you can quickly respond to it and then conclude with your final remarks. So Nigeria has witnessed a wave of protests with thousands flooding the streets. Does WHO foresee a spike in COVID-19 cases?
Yes, I think it's always a concern where you get mass gatherings under conditions where people are not taking the precautions, and certainly under these conditions where people are rioting, demonstrating, We've heard looting. Clearly, people are not taking the precautions and the risk is there. As I said, we were concerned not only by the situation in Nigeria, which is very sad, by the way, and we know that in that process, some of the WHO office in one part of Nigeria was actually looted, and so were some stores of some PPEs, etc. It's a very sad, tragic situation, but it is a concern, and we would wish to see the situation easing as far as possible. And I think then it means that there is need to, as I keep saying, be really sure that the public health interventions are there and to respond, to anticipate, in fact, anticipate that there are likely to be cases at a certain moment in time and to make sure that the interventions are being put in place to minimize the increase in cases that could come out of such a situation. It's similar to the situation in Guinea, as I said before, where there have been mass demonstrations, there has been some violence in very unsafe situations.
Thank you, Dr. Moeti. Before we go, we would like to say a very big thank you to all our panelists, Dr. Mashidisho Moeti, the WHO Regional Director for Africa, Honorable Minister Ibrahima Saidu, the Minister and Special Advisor to the President, Republic of Niger, and CEO for the National Agency for the Information Society, Dr. Ola Brown, founder of Flying Doctors Investment Company in Lagos, Nigeria, Dr. Integrity, the Junior Resident Medical Officer and Head of Innovation, Vaccine Global from Harare. Thank you very much, and thanks to all our participants. So this brings us to the end of today's media briefing. Thank you and have a good day.